Okay, and it looks like we are live, Laura.
Good morning.
This is great. Good morning, everybody. Just want to make sure that everyone can see and hear us. So just please write yes in the chat or thumbs up and let us know that you can hear and see the presentation. All right. Okay, I'm getting the yeses now. I was a little bit scared. I'm like, wasn't seeing as many responses in the general chat. So thank you very much, guys, for following instructions and being a dear and writing out that you can hear and see us. So welcome to day 4, guys, for our first session, which is TMF Inspection Readiness from Chaos to Calm. Really love this title as well. Welcome to session 1 of day 4. We're almost near the end of TMF week. I cannot believe it. But we are ready for a action-packed full day today. I wanted to, before we begin, I just want to make sure that you guys all see everything that is going on. And I just wanted to introduce myself and let you know that my name is Kimberly Bruce. I work on the marketing team here at Montreal, and I'm pleased to be your host for today. And before we begin, I just want to go through some housekeeping rules because we need to do that to make sure that we're all on the same page. So I just want to let you know that all sessions are being recorded and will be made available at the end of the day. So if ever you need to rewatch any sessions that you might have missed because you got up to get a coffee or a drink, depending on where you are in the world, right? Because it could be morning, afternoon, or in the evening, then you can go back to the platform and rewatch any of the sessions, and the slide decks are also available. So just go back to the session and just rewatch. It's that easy. All attendees will receive a certificate of attendance for the entire TMF week conference, not just for one. So be on the lookout for that sometime next week. We will be sending you certificates saying that you guys completed TMF week 2022. Woohoo! So this is an interactive session, so feel free to ask questions at any time. So if you look to the right of your screen, there is an engagement panel, and the engagement panel has the live chat, the Q&A, and also polls. We will be running a couple of polls for this session, so please be on the lookout for that. We will let you know when it is active. But if you have any questions, it is the speech bubble with the question mark. Just make sure to enter in your questions for Laura in there. The questions will be answered at the end of the session, and networking breaks will follow every session. So please visit the lounge or the Montreal booth to rub elbows with your peers, meet new people, and just have a good old time. So now that we got that out of the way, I would like to introduce to you Laura. Laura has over 20 years of experience in the clinical research and marketing industries. Laura currently works as a TMF Services Project Manager at Just in Time GCP, where she coordinates TMF management activities and works with clients to analyze, develop, and implement processes that support business use of electronic clinical systems to ensure TMF quality and completeness. Laura has a passion for organization and collaboration with her colleagues and clients to achieve results. We are so pleased to have you here, Laura, and we cannot wait to see what you have in store for us with your presentation. So I'm going to remove myself and allow you to share your screen.
Okay, well, thank you, Kimberly. Let me get teed up here and we will get started.
Excellent. All right.
Okay, so this is TMF Inspection Readiness from Chaos to Calm, which is what everybody wants to be, right? Thank you for that introduction. So now let's set the scenario. You're being inspected, so what do you do next? We are going to talk today about streamlined, stepwise strategies to move your team from chaos to calm. We'll talk about how to assess your inspection readiness using risk-based tools and approaches. We will talk about timeline and resource constraints and discuss how to engage functional groups in inspection preparedness activities. So first up, what does inspection readiness mean? It means ensuring that the people, processes, and evidence of trial conduct are present for regulatory review. So while your TMF may not be perfect, it should tell the story of the study. So do you have evidence that what you said you were going to do is present in the documentation and data that you have? Can you identify any issues that might make it difficult to tell the story of the study? Can you explain those issues? So for example, did you have a known issue with patient safety? Was there a data integrity issue? Some type of operational or process issue that you're aware of? And can you tell that story? And in telling that story, it's helpful to make storyboards, and you may need to consider writing CAPAs, which we'll talk about a little bit later. So along the way, you may encounter roadblocks. You might have lack of support due to competing priorities. And let's face it, people have different perceptions around the importance of the TMF. You'll often encounter multiple systems and different system owners. And sometimes it's tricky to even define what is TMF completeness and where are all of our documents filed. Sometimes that's a challenge in itself, just to drill down and see, okay, where is everything? What are we really supposed to have here? You may have a lack of training and emphasis on quality documentation within your organization that can create gaps. You'll have to navigate differences in CRO versus sponsor processes, as well as the changing regulatory landscape. So lots of considerations here. So now let's talk about how to assess your current inspection readiness state. Overall, we're going to focus on quality, timeliness, and completeness. So in doing this, your TMF map is a great place to start. So what documents did you expect versus what content did you truly have? So here's kind of some high-level examples, but study team staff documents. Do you have all of your CVs, your handover forms, your training documents? Do you know where those are located? Are those held in a learning management system, for example? All of your IP documents, things like storage records, accountability logs, calibration documents, return and destruction forms, release forms. Then looking at lab documents, you want to make sure you have documentation for each lab involved in the study. So again, things like storage and calibration documents, reference ranges, certifications and accreditation documents, and your lab head CVs for both local and central labs. For patient documentation, you would want things like screening logs, lots of different logs. So subject logs, randomization logs, anything surrounding SAE documentation. But very importantly, you want to make sure that you are not sharing PHI within your patient documentation. So you want to make sure nothing is present that should be confidential. And then you may need to do some cross checks to make sure that information matches. So the number of randomized patients matches the number of subjects visited at a site, etc. So you can also take some clues on inspection readiness from your eTMF. So do you have documents that are in, as I like to say, weird statuses, so non-final documents, QC rejected documents, documents that are in progress, or other statuses? Those are things that you can dig into pretty quickly and identify pretty quickly to figure out, okay, how do we get these documents through to a final status? And then within your eTMF, are you using tools like expected document lists or other reporting tools? And in using these tools, do the outcomes that you see align with what you would expect to see for your study? So if you notice anything odd there in your reporting tools and expected documents lists, again, those are quick things you can take a look at and drill down into. Okay, so Kimberly is going to launch our first poll. What we want to know is, do you perform completeness reviews throughout your studies? So your options are, yes, you do, with a regular cadence. or yes, you do, but there's no set cadence, or no, you do not perform completeness reviews.
Okay, everyone. So as Laura said, I just launched the first poll. So if you go to the right of your screen, there's the engagement panel. And if you go to the poll section, that is where you will be able to submit your answers. It is right next to the Q&A section, which is this speech bubble with the question mark. So I'm seeing answers come in. You guys found it. That's great. I'm happy to hear that. We are happy to hear that. And it looks like numbers are getting in here. Do you have an idea, Laura, of like what the results might be?
Well, I know what I'm hoping for, so let's see.
Let's see, right? Okay, let's see. All right, we're gonna give this a couple of more seconds. And we're ending the poll in 5, 4, 3, 2, 1. All right, I'm showing the results here. And it looks like 61% said yes, regular cadence, and 34% said no. Set cadence.
Okay.
Yes with no set cadence.
Okay, so how many said no again, Kimberly?
No was 3%.
Okay.
No reviewer performed.
Okay, so it sounds like most of you are performing some type of regular completeness review. So that's great because you're already ahead of the game. So you're hopefully moving out of that chaotic state more quickly. So those of you who are not performing reviews on a regular cadence, that might be something you want to consider so that you have fewer gaps along the way. So now let's talk about clues from your completeness or inspection readiness reviews. One big thing is, did you document that you performed a completeness review? So you're doing all this work, but did you actually document it somewhere in the TMF that, yes, we performed the review and this is what we did? What queries did you find? Were the queries resolved? What trends did you observe? So depending on your answer here, you may have a lot of work to do just in working to resolve queries and deal with those things that are already issues. Depending on the number of queries, you might need to assess what queries are of highest importance for your team to work on based on the resources that you have and the timelines that you have. So again, use that risk-based approach. And in doing this, you'll be able to engage your functional groups with a clear and common goal because you can say, okay, here are the queries that we want your group to focus on and kind of divide and conquer along the way. Throughout your completeness reviews, did you find areas where things just didn't add up overall? I think we know when we get into documents, sometimes we see things and we're like, wait a minute, what's this all about? So what are those things that you found maybe that did not add up? Did you rely heavily on notes to file? Were there issues that you discovered during your review, again, that are known issues? So did you have a GCP compliance issue? Was there a data integrity issue? So maybe the wrong data was captured in the database. Did you discover evidence of that during your review? Did you see patient safety issues? And did proper reporting take place? So were those documents reporting patient safety issues filed within the TMF? So just some clues from your completeness reviews. Okay, so would you give a contractor plans and specs for a home and then never go back to the job site until your house was built? Absolutely not. Those of you who've built homes know that in a very short period of time, big mistakes can happen. So even if you have things like your TMF plan, your TMF map, and you feel like, okay, we're solid, we're good here, you still need to do oversight along the way because we know issues happen, things happen along the way. So oversight is definitely key, but where is the evidence? What SOPs did we follow? Can we verify what we did? Did our vendors and CRO train all of their study team members? And where is the documentation of that training? Did we conduct oversight? Does our internal study team know what activities they were responsible for And is there evidence filed? So were functional groups involved in reviewing and sending reports to the sites? Are those documents filed? Did we document deviations and changes? Did we follow regulatory requirements for reporting? So there are a lot of things that your TMF plan will establish as far as, whose SOPs are we following, who is filing what documents, what timelines are the documents expected to be filed in, etc. But again, it's all about the evidence. Where is the evidence filed in the TMF? And then you'll want to do a review of your TMF documentation itself. So what did you say you were going to do? So you have your study plans, your agreements, Toro, TMF plan, monitoring and oversight plans. Okay, so high level, what did you say you were going to do? And then did you really do that? Again, your TMF map is a huge key component. So are all of your filing locations accurate? Did you file things where you said you were filing them in the map? You want to review your expected versus your not expected content. Make sure that's up to date, because again, this is your roadmap during an inspection as to where this content is found. So make sure you have a clear understanding and that everything's updated within your map. Leverage your metrics. So protocol deviations can help you target high-risk sites that you may want to dig into a little bit more. Did you see a lot of misfiled or missing documents? Okay, where were those misfilings occur? Where did they occur? Where did you see gaps in documentation? And then take a situation that you have and try to follow the trail. Can you retrace activities and see that the documentation is filed all along in the TMF? So again, if you find a deviation, can you trace the trail? Do you have the data? Does it provide reasonable evidence of resolution of the deviation or the issue identified? So now we're going to talk a little bit about tools and approaches to make best use of your time and resources moving ahead, because we all know, everyone's busy, everyone has more and more on their plate. So how can we tackle this? So leverage technology. So we talked about it a little bit, but use the tools within your eTMF and other systems. Use your dashboards, your reports, audit trails, and metadata. So see from those reports and technology items where you may have gaps that you can focus on. Do you have missing metadata? That might be something you need to correct. You can put different functional groups on different tasks. Audit trails. Audit trails can be valuable in looking at the timeliness of filing for documents and also who took a look at those documents. And once you take a look at everything, you may need to partner with a vendor and leverage that vendor's knowledge, experience, and resources to help you achieve your goal. Because your vendor can come in and objectively look at things and maybe see things that you didn't see and help ask those hard questions. And then this allows you to maximize time for your own team members within other tasks that you have along the inspection preparedness route. So now let's talk about how you're going to engage functional groups in inspection preparedness. So keep in mind that at the end of the day, your TMF is what you have to show for all of the hard work that's gone into the study overall. The TMF is not the last deliverable, but it's the lasting deliverable. I know, often we get very in the weeds with our day-to-day tasks that sometimes we lose sight of the fact that, okay, the whole purpose of this study is to make products available to patients. So while being inspected creates a level of stress and a little bit of frenzy, it also should be exciting because it should be leading to something positive to help bring those products to patients. And I think sometimes we need to be reminded of that because we're going through and reviewing documents and we're missing this, we're missing that. Okay, what's the big picture here? And sometimes that can really help motivate you along the way. So bring functional groups together for the common goal of understanding the story of the study, and help them understand how their TMF content connects to inspection readiness. If they have gaps in their content, help them understand that, this is a risk because of XYZ. Lay this all out for them, and then find champions within each department who can help drive change and help the functional groups get on board with managing their risks. So now that we've done all of this, looking at dashboards, looking at our maps and plans, what's next? So document what you can't find or what you think might be missing. Then you're going to follow up with the appropriate study team members, CROs, and vendors. Formulate a plan to address those deficiencies, and then track your activities and progress. Make sure you're updating and maintaining storyboards, and open CAPAs if needed, but also ensure that anything that's already open is being addressed. So we're going to talk next a little bit about storyboarding and CAPAs. So why storyboard? Storyboarding helps you understand where you have risk because it outlines the story of the trial. It can help you track trends and events that might lead to inspection questions or findings. So, there's always those things that happen along the way that we find out about, and it's like, oh, we might need to figure this situation out. Why did this happen? What did we do about it, etc. And usually at the end of the study, it's too late to try to identify and remediate the issues. But if you're doing due diligence along the way, that's going to be helpful. So you can respond to questions more quickly and easily during an inspection. Storyboarding allows you to address questions about risk, and again, what you did to mitigate it. How did you have oversight of the situation, and how did you address the gaps or issues? So, kind of a simple example, you have a significant amount of missing documents as an issue. So what action did you take? Okay, we had missing documents. We identified that the CRO was responsible for them. So we held meetings with the CRO. We explained what was missing. We shared queries, etc. We came up with a plan and timelines to help bring the study into compliance. So now we're going to talk a little bit about CAPAs. It's okay if something went wrong, but the goal is to understand why it happened and course correct. We want to try to get to the root cause of the situation. And regulators don't always want to hear that human error or people was the root cause. You really need to look at things like the environment, materials, equipment, and really processes. What processes are involved that may have led to this situation? And then develop your corrective and preventative actions. So corrective actions fix things that happened in the past, while your preventative actions will address things to fix the future. Your preventative action matches the root cause, and keep in mind that a preventative action should not just be an assumption that, hey, we need to retrain people. I think sometimes when things go wrong, the first thing we go to is, okay, well, they weren't trained. They didn't know what they were doing. You really need to dig into that, because retraining is not the key unless you realize, okay, they did not follow the process. We had a process in place. The process was, we've reviewed the process. This is exactly how it's supposed to go, but people didn't follow the process. Okay, then that's what the issue is. You need to retrain. But sometimes people are following the process and things happen. And then that gives you the opportunity to say, okay, we need to take a closer look at our process and see what's really happening here. So again, if you receive a finding, you may need to only provide a brief response, but you can use a chronological approach And again, your storyboarding is going to help you in that, that response. So any shared findings should include a root cause with corrective or preventative actions for each party. And corrective and preventative actions may not both be relevant. So keep that in mind. And again, did the issue stem from a lack of a robust process? And how can you update that process moving forward? So I think those are our key elements to think about. So now let's talk about, once we know what's going on, how do we get organized and foster accountability? We need to set specific action steps to take everyone toward the end goal. Assign owners to those tasks and activities who are best poised to own each action. Then set realistic due dates and regular team meetings. So a lot of times we'll get together, we formulate a great plan. Okay, here's who's doing what, here's when it's due, and then the follow-up kind of goes by the wayside. So be sure you're having those regular meetings to talk about, okay, where are we at with this? Do we need to bring some other people in? Do we need, are we, behind schedule? What's going on? So set the expectation from the start that you will be holding people accountable to complete the actions that your teams agreed upon. So a little bit of a sidebar here. We want to do a poll question to understand better how you are supporting sites during inspections. So if you're a sponsor, are you available during the inspection? Do you support the inspection readiness preparation? Is your CRO expected to support and as a sponsor, you're not involved? Or maybe you don't know how you're supporting the sites. So Kimberly, I'll let you take it away for us.
Excellent. Thank you very much, Laura. So we have activated the second poll. If you make your way over to the poll section of the engagement panel, you will see that it is activated. So get your answers in. We really would love to know how you support sites during inspection. So please answer away. I'm seeing the answers are already coming in. This is amazing. It's great to see engagement from the audience. And I'm also loving the comments that are coming in, which we'll address later on. So we're going to give this a few more seconds. It looks like there's like a tie and looks like somebody's taking a lead. Okay, we're going to end it in 3 seconds. 3, 2, 1. And I'm showing the results. So looks like sponsor available during and sponsor supports prep are tied. 35%. Yeah.
That's interesting. So that's great that the sites are receiving support because a ton of documents are coming from the sites. So, they can definitely be key in making sure that the TMF is complete. So what were our, how many provided no support?
No support was 11%.
Okay.
And I don't know at 17.
Okay. Okay.
Almost 18%.
So thank you all for that feedback. That's just interesting to see, among different organizations, how the sites are being supported. So we're going to touch just a second on remote inspection considerations because, this conference is remote and many of us work remotely. So that, it's kind of the way of the world now. And so what are some remote inspection considerations? Things to think about are, do you need a collaborative site to be able to share documents in real time? Will you have staff available considering when the inspection activities are taking place? So, maybe someone's not going to be at your facility. So you may not know exactly when they're planning to do their inspection. And it would be helpful to know that so that you can have staff available, even if it's outside of their normal working hours, because you need to be able to provide documents in a timely fashion if an inspector can't locate something. This is when your map and your storyboards are increasingly important, because if your map is, very detailed and accurate, hopefully the inspector is going to be able to find everything they need without a hitch. If something comes up and you've already thought it through, then you can reference those storyboards as questions come up. So just a few things for remote considerations. So now we're going to do a little bit of a recap before we get to our Q&A section. So overall, if you're being inspected, okay, it's chaotic. We've got to, bring it down to a place of calm. Let's make a plan and get others involved. Check your documents and data. Did you file everything correctly? Do you have misfiles? Do you have documents that are in strange statuses within your TMF? Can you access all the systems necessary? Did you document all of the systems on your TMF map in a clear fashion? Can you grant an inspector access? And then is there a backup plan? Because as we know, technology is fantastic, but what happens when it doesn't work? What are you going to do? What's the next step there? And then your storyboards. Have you involved multiple functional areas in creating those storyboards so that everyone is on board with what happened throughout the trial? So you get people involved so that you're aware of all of the gaps and anomalies, and then you are developing the plan for, okay, what did we do about this? How did we recognize it? What are we doing moving forward? Did you open any CAPAs, and have you addressed those, or what's the status of those? What are you doing to address those items that you wrote CAPAs for? And it's great to see that a lot of you are already being very proactive by doing regular completeness reviews, but also make sure that you're documenting those completeness reviews in your TMF, just the fact that you did the reviews, and then also make sure that your ongoing oversight is documented in the TMF. So those are some tips that will hopefully bring your teams from the state of chaos to calm. Again, keep in mind that when you're being inspected, it should be a sign of positive things to come. And hopefully, if you're doing all of these things proactively, you'll be in a less of a state of chaos and more of a state of calm moving forward. So with that, I appreciate everyone's time and attention. First thing to kick off today for TMF week. And I will turn it over to you, Kimberly.
Thank you so much, Laura. That was absolutely amazing, and a lot of good tidbits there. I was reading or looking over the chats, and somebody had said the TMF is not the last deliverable, but is the lasting deliverable. That was a great quote that came from Casey. So thank you very much, Casey, for that. There are a lot of good chatter on the live chat section. So right now we are going to get into the Q&A portion. Okay, of the presentation here. So I just wanted to, one of the questions that we have here is there a storyboard template you would recommend?
So a lot of times you can do storyboards. I'm a big fan of Excel. Even in my personal life, I think everything can be tracked with a spreadsheet. So I love Excel, but I think what you can do is say, okay, what are the issues? And it may be more of an iterative process along the way, but lay out what are the issues, and you may even kind of go through your TMF map. You might start with each zone. Okay, were there any issues that are known within each zone? What questions might you have that come up within each zone? I think that's a helpful place to just start getting ideas for the potential needs for items to storyboard on. But you're going to want to track what is the issue, and then, okay, what did we do about it? What are the questions that we still have outstanding? Maybe we need to track down some documents. Maybe someone's left the company and we think, okay, Kimberly had this when she was here. Who can we get this from now? And start to develop, okay, who's going to take on responsibility for this? and what timelines. You may even want to have a priority categorization as well, so that you can, again, manage your resources, because we all know it's sometimes it's very hard to figure out, okay, what we have all these issues. How do we go about triaging them? So that would be my suggestion.
Okay, excellent answer. And I definitely like the part where you were talking about like accountability. People will, be tasked with something and making sure that it is being complete, or you just never know when, moving forward, that when it comes to storyboarding, you need to like figure out like what the risks are and who's accountable for certain things. So I think that was very, very well said. Moving on. So I have a question from Raul, who was saying to explain the difference between TMF inspection and TMF audits.
Okay, so audits are often internal, whereas inspections are from health authorities. So, and I think I saw where there were some responses. Yeah, Marion's with JIT. She had responded within the chat that inspections are typically by health authorities and regulatory bodies, and audits are usually, could be an internal QA person or a company that you're hiring to come in and take a secondary look at things.
Excellent. And next question we have here is, what resources would you recommend for learning how to write a good storyboard? We have Mariah, who says, I keep hearing about how great they are, but I've never been trained on them.
Okay, so Avoca has resources for storyboarding, so you can check that out. But again, I think your functional, the key is, let's get the right functional group representation involved, because often, if you just have a few people involved, you really need to be able to see the whole story and have representation from from every party. So, one group of individuals may be privy and understand a situation that occurred, and, you need to be able to share that with the broader team so that everybody can work on it.
Excellent. Thank you very much for that. Next question we have here.
And I think too, one of the keys is, again, really getting that functional group buy-in. And I know I've probably used that term many times during this presentation, but I think really making sure everyone's on board, and this is not a finger pointing opportunity. It's okay. Hey, this is exciting. This should be exciting. But we know things happened, and how were we proactive about that?
Great. And I thought that was a good point that you had mentioned, where like, instead of looking at it as a stressful situation, looking at it like, as you talked about, exciting for the end user who's going to be receiving the final product. So I'm going to move on to, if the TMF is not the last deliverable, what gets delivered after the TMF?
So, your TMF, it's evolving throughout the study. It's the story of your study. So just because you may not have everything in it at one point, you're assessing the gaps along the way. So, it's kind of an evolving deliverable until the end of the story, or I'm sorry, the end of the study. So you want to make sure that overall it does tell your story of your study, but it's evolving along the way. And assessing those gaps and, addressing the misfiles, that's a great way to make that as complete as possible.
Great. And next question we have here is, potential issues should be addressed in the risk assessment and mitigation plan. When do you enlist this in your process? It would be beneficial to understand your perspective on the pre-CAPA measures.
Okay, let me grab that question again. There's a lot to unpack there. So let me see if I can let me go into, hang on just a second. Okay, I see it now. Potential issues in the risk assessment and mitigation plan. When do you enlist this? So you want to have a plan, up front of how you're going to assess risk and mitigation along the way. But when you're developing your CAPA, you're drilling down into the specifics that actually happened during your study. So you would have an overall plan of, how you're going to tackle risk throughout the study, and maybe just some oversight measures that you're going to take along the way. Again, to being proactive. So a lot of this is about proactively doing those health checks, doing regular oversight, and then you can write CAPAs if needed, specific to issues that are encountered during the study.
Great. Thank you very much for that. So I'm just going to go into, there's some other questions that are coming in that are pending. I'm just going to take a look at that. And great questions, by the way. So thank you guys for being very engaged and wanting to learn more about inspection readiness. So I have one. If sponsor receives some details on TMF findings from an inspector for one study, should the sponsor implement a corrective action related to TMF for that particular study, or should they implement the action for all studies? This is from Vebhav, and I hope I'm saying the name correctly.
So that's a good question. I think if you've discovered something that's a finding in one study, you definitely need to address it in that study. But then also, a lot of times findings, again, we talked about this process, the whole heavy, review of process. If you have the same process in place for other studies, you need to go back and see, okay, are these same things happening in other studies? Because there's potential that, maybe that's the way you've been doing things. So you're going to want to do an assessment, across the board to make sure, okay, this is what findings we received for this study. Now that we're fixing them in this study, okay, how can we leverage that for other studies?
Excellent. Thank you for that, Laura. What are the top things a TMF staff/team should know when it comes to audits for them to be successful?
So I think a big key is, what is in your TMF map? Where are documents filed? Are they filed there? What does your TMF plan say? And then the whole notion of your plans as a whole, reviewing those plans. What a lot of times we'll be talking about different things with clients, and it's like, okay, well, what did your monitoring plan say? Did you have a plan for this? What did you say you were going to do? Okay, well, did you do that? So I think it's just being aware of, for the TMF, like a TMF ops department, I think a lot of that is, okay, do we have QC rejections? Do we have documents in strange statuses, misfiles, quality issues with documents, et cetera? But then for other groups, it's going to go deeper into, did you really follow the processes that you set forth in various plans throughout the study?
Excellent. And I think we have time for one more. You mentioned champions. How does one create a champion? What would be the best case scenario to create a champion for?
So that's a great question, Kimberly. Hopefully, there are those people in the functional groups who are, maybe they kind of have an interest in TMF. And that person can maybe be a champion. I think, really having your TMF ops aligned with people from other functional groups is a great idea, because overall, everybody needs to know what's going on with the TMF, because multiple groups contribute to the TMF. It's not just the TMF ops group. They're coordinating a lot of things, but they're having to get information from a lot of functional groups. So I think too, being able, again, it's not about, you don't want people to panic. You're not trying to finger point, but sometimes you can say, hey, we've done this completeness review, and this is what we have found. And we need to know what's going on here. Where are these documents? Why did this happen in this fashion? Just like, tell us what's going on, because sometimes it's a matter of just trying to understand where people are coming from and what has happened. And it's not this big, big situation, but maybe it is. And then you have to kind of backtrack and say, okay, now this is a situation. What are we going to do about it? Because we know things happen, but it's how you're responding to them and how you're showing that oversight and proactive response that's really going to be beneficial in the end.
Excellent. Great answer. Thank you so much, Laura, for a wonderful presentation, very insightful. And I think a lot of people were able to take that in. There are a lot of great questions, and wanted to thank the audience for getting those out and just learning as much as you possibly can, because again, that's what TMF Week is about. So thank you so much, Laura, for kicking off today with a bang. So thank you for that. Up
Thanks,
next,
Emily.
You're welcome. And up next, 10 will be finding your way through the matrix of data integrity. That is coming up at 10 o'clock. So that is our next session. And of course, it's time for networking. So please head over to the lounge or the Montreal booth, rub elbows with people, get to know them, chat with your peers, group members on a range of subjects, meet new people, or just simply chill and have a good time. I want to thank you all once more for being a great audience. Laura, thank you once more for being a great speaker, and hope to see you again at the next TMF week. And I just want to say goodbye to everyone. And also, please, on your way out, please take the survey that is attached to this session. We really want to get your questions in for the TMF fireside chat that is happening today at 1 p.m. So can't wait to get all of your questions in so that you can ask the experts. Have a great rest of the day. Bye for now.
Thanks, everyone.